Amabara gange ni Nyonyango Margaret, nisomera hano St John Bosco Vocational Training School. Enyuma hombeire ntakumanyira ngo ninsobora kuhika hano mbere mpikira, nkabanta kwitekerezaho nsobora gukora kurungi. Aba Balinda Children's Foundation kitwihera hara kera muno nyowe ndora nibijja kunyamba muno mbibwo maiso.
My name is Joseph Balinda. I am the founder and president of the Balinda Children's Foundation, an organization which helps orphaned children and poor children in general in the greater Chenjojo district. I personally grew up in this area. I was raised here. I went to school here. Growing up, we faced a lot of challenges. There is general poverty in Uganda, and Kyarusozi happens to be one of those areas that have been for generations affected by the poverty that is widespread in this country. This organization was inspired by my father, Mr. Andrew Balinda. Growing up, I would hear stories about the people he helped in the community, the people he sent to school, and the impact he had on the schools around the area. And when I grew up, I decided to take his example and reach out and help my community so that the opportunities that were given to me could be given to other kids in the community. We are focused on 3 areas. We are focused, first of all, at the family level. We are trying to bring down the level of poverty. We are also focused on education. As we all know, education is the key to unlocking the future of these young people. The last aspect that we focus on is healthcare. Wherever you find human beings, wherever you find poverty, you find diseases.
Abana mukaga kandi abana bona mukaga bali batari kusoma. Aba Balinda Foundation banyamba batwara abana hisomero, hati abana 5 bali mu isomero ne basoma, ne babasasura school fees, baba uniform ne nkaito ne bitabu na kalamu. Aba Balinda Foundation bagaruka babaletera ebintu ebyo kubyamera ebitabu, omufaliso, blanket hamwe n'esuuka. Ebizibu ebinkurabamu habwa abaana kuguma nibarwara kandi nibarwara nibansanga obundi tinyine na sente z'okugamba nabatwara mu irwarro kandi baguma nibarwara habwokuba n'enju eyinkubalindiramu teri nungi emibi neerabamu neebalya.
When we discovered her in 2016, the husband had abandoned the family, the kids were not going to school, their basic needs were not being met, and we felt the need to intervene because her situation was very dire. The first thing we did was to address the most basic needs of these kids. Their clothing were torn, they had no shoes, they were sleeping on the floor without mattresses, so we provided them with these tools to be able to, function as normal human beings. But at the same time, there's still challenges because we don't have the means to address their entire needs. Their house, it's in a very poor state. The house has holes whereby during the rainy season it gets very cold and the kids can develop pneumonia and other cold-related diseases. Mosquitoes are able to pass through the holes and the kids end up catching malaria. The flooring of their house is basically dust. It's a breeding ground for insects like fleas and bedbugs. So obviously we need to address their home situation whereby we can improve their physical house. But we do not have the means yet to do that. At the family level, we are trying to bring down the level of poverty.
Ninsime kitongole ekyaja kunyombekera eno enju eri enyikainyene nayo ngigi egwire enjura negwamu ebidongo nibihomoka ninsima muno ekitongole kyabalinda foundation kunyombekera enju.
People live on less than $1 a day, and most families in Uganda have at least 5 members. And when there is poverty, it becomes a challenge to send them to school, to feed them, and to give them the kind of opportunities that they need to become productive members of society. The other thing we are addressing, obviously, when you come into a family that is poverty-stricken, the children will not have proper clothing, the children will not have proper meals, the children will not have the basic necessities of life. So at the family level, we are providing the basic needs of the entire family. We are coming in and supplementing on the activities that they are doing, let's say farming, livestock. So there are families that are rearing goats, cows, chickens, pigs to earn an income so they can be able to support their children instead of continuously depending on our support. One of the main driving forces of our organization is to make families self-sustainable. But we also go over and beyond and address their long-term needs in terms of creating income-generating activities so the families can survive on their own.
I thank the Balinda Children Foundation for the help and support they have given us in giving us books, clothes, food and school fees, guidance and counseling. They have helped us in all of the requirements and scholastic materials which children they need.
Uganda has a universal primary education scheme whereby kids can attend primary school without having to pay school fees. But that is just in theory. When you go on the ground, because the schools are underfunded and because there's not enough teachers to teach the high numbers of kids in the community, kids end up not performing well. So parents come up with an arrangement whereby they contribute fees towards the functioning of the schools. And a lot of these kids cannot afford these school mandated fees that the parents have to pay. So that is where we come in and help them meet those requirements in order for them to be able to attend school.
Nisoma Chesos Primary School, class in P4. Ni basime birunje munkolire mungulie vitabu na uniform mumperire so mwibale mu.
We all know education is the key to unlocking the future of these young people. We support kids in the schools. We pay their school fees directly to the schools. We buy them school uniforms. We buy them scholastic materials, books, pens, pencils, and every other thing that a child needs to be able to go to school and be successful.
Having grown up in this community, and I can see the value of education. There are many challenges when children don't go to school. They get married at a very early age, and that means that they give birth still at a very early age, and that affects the reproductive system, but also poses health risks to their lives. A number of them have died of HIV and AIDS, others have died of maternal-related issues, and others probably poverty-related issues.
We have been having children who drop and those who fail to perform well because they don't have scholastic materials. So we believe if they can enroll more on board, they hope many children, as we have them very many, our children will be able to finish the primary cycle and even continue for higher education.
When they are educated, they are able to find employment, they are able to stand on their own, they are able to bring opportunities into the community, they can start businesses, they can employ other people. We also focused on vocational training for kids that are a little bit grown, so they can obtain skills in order to become self-reliant. We have students in technical schools, in vocational schools, so they're doing carpentry, construction, they're doing sewing, and after their courses are completed, they can start a business in order for them to earn an income and be able to support their families.
Without the Balinda Children's Foundation Uganda, these people wouldn't have got a chance to get these skills, to help them to be self-reliant and compete favorably in this global economy.
In Uganda, the government is supposed to provide free health care to all its citizens, but this only happens in theory. You go to a health center, the medications are not there, the nurses are not there, the doctors are not enough, the staff is undertrained, the health centers are understaffed. Sometimes they will diagnose the illness, but they will not have the medication to give to you. So you have to find other private clinics to be able to address your situation. So this is where we come in to try to supplement and fill the void that the government leaves. So how are we addressing healthcare? We have partnered with a local clinic in the area such that our children who are enrolled in the program can go for regular medical checkups, and whenever they're sick, they go and access treatment. We have an insurance scheme with them whereby we pay an annual fee, and the clinic provides services to the children in our program. the prevalence rate of HIV in our community is very high. It's higher than the national average because of the higher poverty levels, the illiteracy. So a lot of families have lost parents to HIV, and they've left behind children who are HIV positive themselves. These kids need antiretroviral drugs. They need nutritional foods to help them boost their immunity. Challenges like these obviously take a lot of funds, but we're doing what we can to address these needs. But with more support, we will be able to expand and reach more people.
We have about 20 children who are in school, but also a bigger number that are out there in the families that we are supporting. Of course, our outlook is to support many more families. The poverty in this area is really, really grave, and that children lack very basic needs. I mean, children are sleeping on the floor, children are sleeping on banana leaves, children are still sleeping in environments or in houses that are mud and water and that are not clearly shut, and that exposes them to many other health risks like malaria. If you look at where children are coming from, where they get water, where they get firewood, especially for the girl children, it exposes them to many other risks like rape, like defilement, which is very rampant, and also given the HIV prevalence in this community, which is way above the national prevalence rate of 7 to 7.3. This community's HIV prevalence is about 12 or even more. It could actually reach 20% because of what has happened in this community in the last 20 years.
So our approach is to address the child's needs in a holistic way. If you address the education needs of children, they're going to go back home and there's not going to be food to eat. And if they are not well fed, they won't be able to succeed in school. That is why we chose to address every aspect of the children's needs so they can fully take advantage of their potentials.
When we get such a people like Balinda Children's Foundation, we expect a lot. First of all, our children will get education service. Not only education service, they will get knowledge after they are educated. After their education, we are expecting to get employments where they get some funds. You know, we have many people in rural areas where they fail to get employments.
When I started this organization, it started as an idea out of my head. As I've moved along, people have joined me, so it becomes easier and easier to reach more people and help more people because there's a lot of people that need help. So we plan to reach as many kids as possible. There's hundreds and thousands of kids still in their homes not going to school. Our plan is to reach every child and be able to provide them with an education. Our plan is to make sure that no child is dying from malaria. Our plan is to educate the parents to practice safe methods of family living so they don't pass HIV to their kids or so that they don't receive it themselves. Our plan is to reduce poverty at the family level by creating capacity and building these small businesses, raising a goat, rearing a chicken, so the families are able to stand on their own long after we're gone. And actually our plan is after 5 years, the family should be able to stand on their own because of the activities that we've helped them create to raise income.
My call to the leaders, my call to individuals that support the cause of fighting poverty, that want to see development in this country, but also specifically in this community, is to give a hand to support. We have seen that with the little that we started with as individuals, we were able to help children whose lives have been changed, whose lives have been transformed. And you can support in different ways. You can donate clothing, you can donate food, you can pay school fees, you can pay for livelihood support activities and income generating activities. Because we started small and we've seen how far we have gone.
So we appeal to every individual out there, friends, organizations, private donors, to join us because we have seen our methods, they work. When we've entered the family, their lives have been transformed. And you can see the impact by the smiles on these kids' faces. So we thank those who have joined us, and we pray that more people will join us and provide opportunities to these forgotten children.